doctors because they can help people, and that gives like a satisfaction, not only knowing that you're changing lives, but also the fact that it's a successful job you can have a steady income at. I think it's also well respected in the community, so you kind of look at it as something where you're not only, it's like something that has to be done, but you're getting paid well for it, but then you're also helping people, so it's kind of the perfect scenario. And they're well respected because the amount of education that they need to put into it, so they're kind of like the top of society and like education wise, because they put in like half their life basically into like all the education they do.
In America, most physicians spend an average of 14 years training for their job. This includes their 4 years of college, 4 years of medical school, residency, fellowship, and then the last 3 to 8 years training. They also get very frustrated because the average debt that they come out of medical school with is $167,000. American doctors spend about an hour a day, equating to $83,000 a year, dealing with the paperwork of insurance companies. However, their office staff spends more than 7 hours a day on paperwork. Many doctors feel that this is a wasteful drain on their time and resources. Over the years, patient doctor interaction time has been decreasing. The average time a physician reports on a patient time is less than 9 minutes. This takes away valuable time that could be spent building a trusting relationship. Due to the fear of being sued, many doctors practice defensive medicine, meaning they order unnecessary tests, therapies, and procedures in order to clear themselves of all possible blame. They overtreat conditions in the pursuit of avoiding a lawsuit. In addition, they must purchase expensive malpractice insurance in the event that they are sued. Some doctors feel they do not get the deserved respect from administrators, colleagues, or patients. Other doctors feel that the lack of respect is more institutional, feeling it in the form of more and more constraints from corporate structure.
I think there's a lot of negatives because obviously it's long hours, you're away from your family a lot, and there's a lot of paperwork with insurance. And so anyone who's motivated by money or prestige to be a doctor, eventually they'll burn out. You just have to have that motivation to want to help people every day, and that's exactly why I want to be a doctor.